Welcome to the Prioritizing Prevention, Translating Science to Practice podcast. Our goal is to prioritize prevention conversations that matter. Our topic for today is examining prevention with a trauma-informed lens, with special guest, Amy Hawthorne. Now here's our host, Holly Raffle.
Hello, and welcome to Season 2, Episode 4 of the Ohio Center of Excellence for Behavioral Health Prevention and Promotion podcast, Prioritizing Prevention, Translating Science to Practice. I'm Holly Raffle, and I have the privilege of serving as the faculty director of the center. Today, I am so excited to welcome Amy Hawthorne to the podcast to support the prevention community in thinking about prevention with a trauma-informed lens. Amy Hawthorne, who is an OCPSA, is the Trauma-Informed Care Coordinator with the Ohio Department of Mental Health and Addiction Services. She received her undergraduate degree from Ohio University, and I just found out she was in one of my large sections of Health 202 when I used to teach that back in the Wayback Machine, so I'm even more excited for this guest. And she also earned her graduate degree in Public Policy Management from the John Glenn College of Public Affairs at The Ohio State University. For 10 years, Amy helped to implement public health models of sexual and intimate partner violence prevention in school and community settings. She has worked to ensure behavior and cultural changes are trauma-informed, inclusive, and accessible. She is currently working to coordinate statewide trauma-informed efforts, connect resources and people providing direct services, and assist in trauma-informed systems change to better serve all Ohioans. This month, the center is focusing on trauma-informed approaches to prevention, and I really appreciate that Amy is sharing her experience and expertise with our podcast community. Welcome, and thank you for joining us, Amy.
Thank you. I'm very excited to be here.
So, Amy, this season, we've been starting our podcast with a segment called Beyond the Bio. This is a time when you're able to tell our listeners something about you beyond your bio. So maybe a little bit more about what your work looks like on the daily and which part of your work that you enjoy the most.
Thinking a little bit about me, I would like to let people know that I grew up in a small Appalachian town on the eastern border of Ohio. And I really appreciated growing up there. And it has given me a lot of sense about the different demographics that we reach in Ohio. And I think that one of the most rewarding parts of my job is just traveling around the state, learning all about the great trauma informed work that people are doing and the different programs and projects that people are piloting and trying. And I get to share those innovative ideas across communities and help connect resources and people. So that's my favorite joy so far.
Oh, well, thank you so much for your public service and keeping the public in public service by getting out there, traveling, listening to folks, and seeing what's working so that can be spread across our entire state. So, we're having this conversation ahead of Trauma Informed Care Awareness Month in May as a way to lay the foundation for local planning efforts highlighting trauma informed care. As you know, prevention professionals are working across Ohio at the individual, organizational, and community level on a daily basis, and it's important for us to recognize and respond to the effects of trauma at many levels. So, to make sure our listeners are on the same page, I'd like to start our conversation with a real broad view by defining key terms related to a trauma informed approach. My first question is really pretty basic, but yet foundational. What do we mean by trauma, and how does it impact the health of individuals as well as the health of communities?
That is a great question because there are several definitions for trauma out there. And so I tend to gravitate toward an inclusive definition because it can be individualistic for people. So for a central understanding, I use SAMHSA's definition explaining that individual trauma results from an event, series of events, or a set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening and has lasting adverse effects on the individual's functioning in mental, physical, social, emotional, or spiritual well-being. So traumatic events may be experienced by an individual, a generation, and also an entire community or culture. I also would like to recognize, without going into too much depth or detail, the neurobiology of trauma. I think that's very important when we're thinking about defining what trauma is. So, the neurobiology of trauma, which is the understanding that a traumatic event or experience can alter a person's brain chemistry and that the brain can begin to function differently as a result of traumatic experiences. And this is something that's called fear circuity, and it's a protective mechanism which we all have inside of us. And so, to sort of shift gears a little bit into some of the impacts of trauma, which I believe was the second part of your question. We know that there are numerous poor and unhealthy outcomes associated with people who have experienced trauma and adverse childhood experiences. There was a very recent study published in December of 2023, and this study highlighted the economic burden of health conditions associated with adverse childhood experiences among US adults. So, in the study, what the authors have found was something that we knew is that 63% of US adults have have ACEs. So those are adverse childhood experiences. Those are what we call ACEs. And the national economic burden of an ACE-related adult health condition, it reaches $14.1 trillion annually. Trillion dollars annually. So this is, and the way that they figured this number is they have it categorized as 183 billion. That's in direct medical spending, and then a 13.9 trillion in loss of healthy life years. So if you break that down to a person, to an adult who has experienced adverse or has a high ACE score, that person has the economic burden is 88,000 per affected adult annually. So that's a big, big number. So this is obviously impacting on such a magnitude, on such a level that it affects 64% of US adults. I want to just sort of give our audience members a greater understanding of how the study identifies ACEs. And so what they included was, people who are familiar with the Kaiser Permanente study very similarly, they are experiencing abuse or neglect. They're witnessing violence or living in a household with substance use disorder, mental health problems, or instability from parental separation or incarceration. And we know that adults who have ACEs are more engaged in risky behavior and they have health outcomes associated with those risky behaviors. And so some our adult population and a lot of our youth population because of trauma might be experiencing anxiety, depression. There's also chronic health issues like asthma, arthritis, heart disease, stroke, and engaging in violent or unhealthy relationships. We also know that some of the riskier behaviors associated with trauma and ACEs are heavy drinking, illicit drug use, overweight and obesity, and smoking. And we know that those lead to poor outcomes, poor health outcomes as well. So there's a lot of stuff going on, and there's definitely a broad definition, and there's lots of things and areas for us to focus on. But it is also important to take that bird's eye view so that we can get a big picture of the issues that our people are facing.
Absolutely, Amy. And 65%, that means the majority of people that we come into contact with each and every day have experienced some form of trauma. So we really need to hone in on what it means to be trauma informed. So, can you help our audience understand what it means for something or someone to be trauma informed?
Absolutely. Trauma informed or trauma informed care can exist in a multitude of spaces and environments. And it's the assumption that an individual is more likely than not to have a history of trauma and recognize the symptoms of trauma and acknowledge the role that trauma may play in an individual's life. We don't necessarily need to question people about their experiences, but rather just assume that they may have a history and proceed accordingly and appropriately. And I really want people to understand that it can encompass all of our senses, right? So think about how things might sound or how they might smell. Or, like when you walk into a doctor's office or a behavioral health setting or a community clinic, what are we seeing? Are there brochures everywhere? So thinking about all of the senses and just assuming that more people are more likely than not to have experienced trauma. And being trauma informed recognizes all of those things in a person's environment and aims to help make them feel comfortable and make them feel safe so that we are encouraging health and encouraging recovery. It's also important to recognize that many individuals who seek or who are involved in our systems have histories of trauma, but don't necessarily recognize the symptoms or the effects that trauma plays in their lives. Treatment providers, frontline workers, and all community based programs can build trauma informed environments across the continuum of care. This includes providing a safe, collaborative, and compassionate space, preventing treatment practices that might re traumatize people, building on the strengths of resilience they have already shown, and endorsing TIC principles across services and within our practices and within our policies. So trauma informed care is very important to me for lots of reasons, but it's also important for all of us because we know that our vulnerable populations experience trauma at higher rates and may rightfully be afraid to seek services or interventions. Our spaces, services, and service providers can help to interrupt this cycle and encourage necessary care. Our patients, our vulnerable populations who have experienced trauma can benefit from emerging best practices in trauma informed care. These practices involve both organizational, clinical changes, and they have the potential to improve patient engagement. They have the potential to improve health outcomes, yeah, and also provider and staff wellness. And then importantly, decrease unnecessary utilization.
You certainly made the case that it is really important to make trauma informed care be a part of your personal prevention practice. So I was curious, can you kind of walk me through a trauma informed approach on an individual level as an example so people can see, hey, what's one small nugget of a trauma informed approach that I can use to support an individual?
Oh, that's a great question. And so, as individuals, we have the fortitude to create and promote environments of healing and recovery rather than practices that may inadvertently re traumatize. So, at an individual level, I immediately think of clinical practices which might not be, relevant to everybody. So I started thinking, for preventionists working with a public health model, we can think about it within a school setting. And so tier two or tier three would be that individual level, providing early interventions or intensive supports to students and staff that are presenting signs of at risk. So the organizational or systems level, comparatively, that would be relative to tier one approach, creating safe environments and promoting the health and wellness of all students. So if we are aware of trauma informed care as individuals, we have the opportunity to use it in all of our interactions, with our peers and colleagues, friends, spouses, and partners even when interacting with people at our gas stations, grocery stores, and restaurants. Being trauma informed goes a long way and it can help us recognize when an individual presents a trauma response and to help us respond accordingly. It is also important to recognize that we as individuals we went through a global pandemic. And so individual responses will definitely vary, but collectively, people have experienced trauma from that. And so we can help to set our systems and organizations up to respond to that. But at a micro level, it is the individual approach that we want to take to make sure that we're helping people feel safe and sharing and that they are encouraged and given a strength based approach and an empowerment model to kind of help them formulating the decisions that they're making, if that makes sense.
Oh, absolutely. And it's really important for us to think about and be mindful that we can be trauma informed in our work life, but it's almost equally as important that we're trauma informed in our personal life because we don't know what that person, who is taking our order, serving our food, or at the grocery store, putting our groceries in our trunk or however we get our groceries, what they've experienced, right? And so I just really appreciate that reminder that trauma informed approaches transfer, right, from work to home.
Oh, absolutely. And it's also, it's important for me in the work that I do that I walk the walk. I really want to model the behavior that we would like to see. And so I think that bringing it into a personal space also helps to reinforce it at that professional level.
And we know our preventionists who are listening work on the PSE, the policy, systems, and environmental level. So, can you help us understand a little bit about what it looks like to implement a trauma informed approach at the systems level?
Absolutely. So, a systems level approach to trauma informed care goes beyond that clinical or individual level and provides the supports necessary for broad organizational culture change. Dr. Sandra Bloom created the sanctuary model, which is a theory based approach to changing and sustaining a trauma informed organizational culture. So, this specific model, which is not the only model, but this model is widely used and studied, is organized around four pillars. So, those four pillars of the sanctuary model are shared knowledge, shared values, shared language, and shared practice. But not everybody is able to access or has the resources to bring the sanctuary model into their organizations or into their systems. So I also like to offer, SAMHSA's definition. SAMHSA defines a systems level approach and realizes that the widespread impact of trauma, uh, and they help us to understand the potential paths for recovery, and they also help us to recognize the signs and symptoms of trauma in clients, families, staff, and others involved with the systems and respond by fully integrating the knowledge about trauma into our policies, procedures, practices. And then again, that most important message that always gets repeated is the resist of re traumatization of the people that we're seeing and the people that we're treating. So also another note that I wanted to make sure people are aware of are the National Child Traumatic Stress Network. So this network and SAMHSA, they provide organizational assessments that can be found online and they can be used as a tool to help our organizations assess their current practices. Trauma informed organizations, they what they do is they infuse and sustain trauma awareness, knowledge, and skills into their cultures, practices, and policies. So it can be, it can be challenging. And I would encourage people to, just put one foot in front of the other and do a lot of research about what might be the best approach for their specific agency. In addition to that, we know the benefits of creating a trauma informed workforce include those good tick practices. They're sort of baked into the recruiting, hiring, and maintaining a trauma informed staff. And it's also about providing solid evidence based training on emerging trauma informed best practices, develop competencies specific to TIC, and also addressing ethical considerations. We also want to make sure that we're paying attention to our staff and preventing and treating secondary and vicarious trauma as well.
Amy, thank you so much for providing just a litany of resources for our listeners. And many of our listeners are listening to us while they're driving or they're out for a walk. And rest assured that we'll get everything in the show notes. So, all the links and all the resources that you've provided, just check the show notes and you can get plugged into those. So I do have this question that I've been just so excited to ask you is I have the privilege of working with community leaders in Ashtabula County who are part of Ohio's Trauma Competent Care Collaborative. That's a partnership between Ohio Moss and the Ohio Department of Developmental Disabilities. I know that language is important, and I'm curious about the nuance between the terms trauma informed and trauma competent. Can you help me and maybe our listeners too understand the difference and similarities between these two terms?
That is an excellent question. And there are a lot of terms out there that we often, get confused about. So thank you for providing a time and space to differentiate between the two. So the framework for the Trauma Competent Care Initiative is we always want to be growing with the goal of becoming competent in trauma informed care. So it's stretching those muscles, and it's also having that collaborative approach and being able to form the important relationships with other agencies like DODD who are providing similar trauma informed care approaches, reaching different demographics. And so that trauma competent care is the goal in being and utilizing best practices. And one of those best practices that we want to maintain is the collaboration effort. And it also helps our different agencies and different approaches that we might have from our agencies and within them find a common language and find a common thread that can be kind of woven throughout all of our services.
Absolutely, that makes sense. And so what I'm hearing is that we've got this trauma informed care, and we weave that in at the individual level and at the organizational community levels with that goal of hosting a community that's providing trauma competent care to all of its residents.
Absolutely. And one of the competent initiatives, uh, it was identified, this was pre my employment, but, understanding the work, it was important through the strategic planning efforts that trauma informed care was identified within the three domains, which are a cultural domain, an organizational domain, and a clinical domain.
Thank you so much for helping to tease that out for me. And I do hope for our listeners out there that it was valuable as well. As we start to dive a little bit deeper into trauma informed care approaches to prevention, SAMHSA and Ohio's trauma competent care initiatives have identified 6 key principles to a trauma informed approach. So, if it's okay with you, I'd like to just go through each principle one by one and then ask you to give probably 1 or 2 sentence expansion on that so our listeners have a good idea of what all those principles are.
Oh, that sounds great.
All right. So the first principle is safety. What would that look like for our listeners?
Okay, so we all deserve to have physical and emotional safety, especially in the places where we spend the majority of our time. We can look to be proactive with our emotional and physical safety by defining and expressing boundaries that help us to feel safe. However, we all know that that is not possible for everyone, especially people who have experienced trauma or traumatic brain injuries. Being trauma informed around safety includes making sure areas are well lit, doors are secure, and people are trained in preparation to respond to emergencies that can occur. We can also it can be such a simple practice as well as setting up our meetings with our peers and colleagues and our clients to ensure people feel safe in sharing and that they're not coming from a fear based place.
Thank you. Our second principle is trustworthiness and transparency. What might that look like to our listeners?
So the second principle, uh, trustworthiness and transparency, I think of some of the first things that come to my mind are respect and fairness, because respect and fairness help to build trust, right? And this reaches a basic primal need within us that can spark our pack or inherently social behaviors and dynamics. So we want to make sure that our operations and our decisions are made with transparency to foster trust and to help build and cultivate those relationships that we have. So we want to make sure that with the people that we're serving, that we're not over promising and under delivering, right? It's very important that we need to be clear about what is possible, what people can expect within a timeline, within a time frame, and what is not possible and what we do not have the abilities to do.
Thank you so much for expanding on trustworthiness and transparency. And that brings us to our third principle of peer support and mutual self help.
Yeah, so peer support is crucial, right? It's also very effective. This is ensuring and including support from those with lived experience, or if we're thinking about children, in the case of children, support from their family members. So, peer support is a protective measure, especially in children. Findings indicated that family and adult support, school adult support, and school's peer support were all independently associated with mental well being in children and adolescents. This suggests that all of our sources are protective factors for well-being. So having that, that sort of the team around you can definitely be a trauma-informed approach that leads to better outcomes.
So, our fourth principle is collaboration and mutuality. And, I think peer support really resonates with folks and they can understand that. But how do we move into that fourth principle?
This is one of my favorite principles, as maybe nerdy as that sounds. It really is because this principle addresses power dynamics, right? And so it's very important that we are aware of the dynamics in order to foster healthy environments that promote healing and recovery, right? So leveling power dynamics is important between and among staff and also when we're working with our clients. I also think this element is crucial when working with youth because we want to make sure that an inherent power structure is understood but not limiting or it's not stifling. Collaborating and mutuality requires that recognition that multiple perspectives and experiences create a trauma informed space.
It takes a lot of effort, right? So, you really have to think about every time you are walking into a meeting or setting up a group, what are the things you need to think about behind the scenes to create that space where collaboration and mutuality can exist?
Absolutely. And so it takes some self-awareness and understanding that there are different power dynamics at play. And some of those are very implicit and some are explicit. And so we want to definitely pay attention to the nuances and how we might create a space that is more collaborative and more equal.
And I really feel like these principles all build on one another because when you think about the space and the environment you're creating, that leads us to that fifth principle of empowerment, voice, and choice.
Yeah. So when we make our own decisions, we are empowered. We feel good, right? We exercise those decision making muscles and obtain the strength and continue to build strength from those experiences. And I do want to definitely recognize that it's okay to make mistakes, right? If we have a trauma informed environment, we can make mistakes and we use them as opportunities for growth, right? So creating a trauma informed space requires us to recognize the decisions people or our clients have already made in an effort to keep them safe. So those recognitions help to build resiliency and over time can improve outcomes. I think it's very important to recognize that, if somebody is coming to us and sharing an experience or a traumatic experience that they might have encountered or endured, that we want to recognize what the decision that got them to the door, that brought them to our clinic or our behavioral health center. Because recognizing the steps that they have already taken helps them to feel empowered because they've made those decisions.
I think recognizing that people have agency and self determination is really important. And I really appreciate the fact that you brought up that trauma informed care, creating trauma informed spaces doesn't mean we have to be perfect. And that really lends itself to the sixth principle of cultural, historical, and gender issues. Because none of us can understand all of the history and the culture and what gender brings to a particular person. And so sometimes we are going to make mistakes, and it's how we act in that moment that helps us move beyond those stereotypes, biases, whether implicit or explicit.
Absolutely. And so that's very true. This principle asks us to move beyond, right? The beyond the cultural and the gendered stereotypes and the biases that exist. So this principle acknowledges the implicit and explicit biases we carry, and it's our responsibility, right? We must recognize and eliminate any biases we have to better serve our clients and create trauma-informed environments. So this really forces us to recognize that not everybody is the same, right? And we need to meet people where they are, and we need to recognize what they are bringing to the table. The same approaches are not always going to work, and that we will definitely need to modify some of our approaches for people based on their culture, their history, their gender, and their experiences. And we can't get in a mindset a one size fits all approach. And we really need to pay attention to what how people are operating, what their histories, what their cultures are bringing. It's important for us to recognize all of the different cultures that people have and to modify our approaches and practices with them so we can provide the individual with the best possible care and continue to engage that person on a road to recovery.
Thank you so much for going through the 6 principles of trauma informed care. The purpose of our podcast is how to translate science to practice, and that's sort of our tagline. And so I'd like to leave our listeners with some resources as they tap into work to learn more or implement trauma informed practices, programs, and policies. So, what guidance would you offer our listeners who want to support trauma informed systems change?
Oh, great. So I would first applaud the efforts in wanting to create trauma informed systems change and remind people that it's an effort that will take time. And like we recognized before, it's okay to make mistakes. And that if we take the time to cultivate and learn from those mistakes, we will have a better success, right? So we just wanna learn from them, and that we we wanna recognize that there's not a one-size-fits-all prescriptive that fits every single environment. Organizations will go a long way in their efforts if they recognize macro level influences, including societal norms, generational history, the different government policies and laws that impact individuals in different ways. And we're also wanting to recognize how those influences are impacting our staff and the people that we employ, not only the people that we serve, but also the people we employ and that our colleagues and peers. So a trauma informed systems approach requires a collective effort where the organizational culture will need to value lived experiences and trauma experiences of a person's ancestors that continue to affect an individual today. I would also recommend that the efforts consult many voices within their agencies and the people they are serving. So there is this phrase, and I think I saw this in one of your previous episodes that you know, not do not sort of make decisions about us without us. And so to make broad sweeping changes, we want to be considerate of the anxiety that that might cause. So we want to definitely make sure that we are hearing all of the voices who are going to be affected and that they have a say at the changes. We always want to make an effort to meet people where they are. So it is a collective approach, but definitely leadership can go a long way and modeling the behaviors that they want, and then also recognizing that their staff are human, that there's a multitude of lived experiences, and to be able to value and recognize the strengths that people are bringing to the table, and to make sure that the efforts are collective. There are so many wonderful resources out there, and I'll make sure that you all have access to them because, like I said, there's not just a one size fits all approach. We have to think about the demographics of the people that we're serving, the demographics, and ensuring that the spaces where people are coming are reflective of the community. And that takes time. And we also want to make sure that it's spread throughout all of our practices, and that includes hiring practices, retention efforts, and making sure that people are treated fairly, not only in the services that we provide, but also in the way that the way that we are seeing the successes of our staff.
Absolutely. I know you mentioned there's quite a bit of resources and support, and we will get that in our show notes. So I think our show notes are going to be so expansive. It's chock full of things for people who are interested in incorporating trauma informed care into their practice. But I also have a feeling that folks are going to want to know what professional development opportunities that you recommend.
There are a lot. We are very resource rich in Central Ohio and Ohio because there's so many virtual spaces and opportunities as well. My colleague at the Department of Youth and Children created excellent info sheets that break down areas of trauma and trauma informed care into very digestible chunks. The info sheets were created for all audiences, so no one needs to be an expert or a clinician to use that. Additionally, we have a multitude of trauma-informed care trainings housed on our eBased Academy. eBased Academy is a learning platform that is free for anyone to make an account. You just go to ebasedacademy.com, you set up an account if you don't already have one, and you are able to access trauma-informed care trainings there. And there's learning checks along the way for people. And I do always defer to SAMHSA and CDC resources. I also want to include an effort for prevention professionals to include the PACES science. And so PACES science, which refers to research about the effects of positive childhood experiences and how they work together to affect our lives. So PACES, this work builds on knowledge that the brain is plastic and the body wants to heal, right? So this part of PACES science includes evidence-based practice by people, organizations, and communities that are integrating trauma-informed care resilience building practices. So the PACES work are excellent for our prevention professionals. And I really want to encourage that wealth of science because it really does it is somewhat of an intervention, but it's the science of thinking that the brain wants to heal and that the brain is continually changing and responses to environments. And so the prevention space in our state is filled with great resources. And I'm thinking along the lines of, Prevention Action Alliance and LCAM and how, they can also bring trauma informed care and PACES science into a prevention space for us.
Absolutely. And highlighting the fact that while we can't control what happened to individuals and the response that happens because of the individuals, because some of it's biological, it's not forever, right? And what we can do is create those healthy, nurturing environments that support individuals who have experienced trauma. And in reality, those types of environments support everyone.
That's very true. Yeah. So those nice positive places that we can make sure that we're supplying and helping to enrich for people, they go a long way. It's all about building resiliency and helping to cultivate resiliency with people. And I do want to recognize that resiliency is not necessarily, just bouncing back. There's that term can be a little misleading, and that oh, this terrible thing has happened, and I can just bounce back, or what's wrong with me? Why can't I just bounce back? Or what's wrong with that person? Why can't they just it's over. The incident is over. Why can't they just, get back to normal or whatever? And resiliency is not that. Resiliency is more so about adapting to our new environments or to our new perspective and understanding that we may have experienced a traumatic incident and that I don't necessarily need to bounce back, but I need to learn how to adapt and take care of my mental and behavioral health.
And that is the perfect place as we, try to land this plane here and get folks on to the rest of their day. And I really appreciate ending on that note of resiliency and what that means and how it can mean different things to different people at different times.
Absolutely. We're all different. It takes all kinds. And so we should celebrate those things.
Very true. We've reached a time on the podcast where we ask our guests a few rapid fire questions to close out our conversation. And this really is our listeners' favorite part. And it helps them get to know a little bit more about the person that they've been listening to for the past half hour. When working in trauma informed care, I can imagine that it's important to find ways to take care of your own mental health. So we're going to do some rapid fire questions in a wellness edition. Would you rather relax by watching cooking shows or home renovation improvement shows?
Cooking shows.
Would you rather spend time in the great outdoors or spend time cozy on the couch?
Oh, that's 50-50. But so when it's winter and cold outside, I want to be on the couch. When it's warm, I want to be outside in nature.
Fair enough. Finally, this is a question we ask all of our guests. You're reaching into that bowl of M&Ms. Are you looking for plain or peanut?
Yeah.
Me too. Here at the center, we believe that podcasts are a form of professional development, and we believe that professional development is a form of self-care. Amy, thank you for taking the time today to expand our collective knowledge on trauma-informed care. And thank you to our listeners for joining us today, as it is our shared and accumulated knowledge that changes prevention practice. You are listening to the Ohio Center of Excellence for Behavioral Health Prevention and Promotion podcast, prioritizing prevention, translating science to practice. This podcast is produced by Ivory Lloyd at Global Insight Production. If you enjoyed this episode and would like to help support the podcast, please share it with others, post about it on social media, or set the podcast to automatically download on your favorite channel. To catch all the latest from the Center of Excellence, follow us on LinkedIn, Instagram, X, and Facebook at OH Prevention COE, or visit us at preventioncoe.ohio.gov to sign up for our monthly newsletter. As always, thank you to the support team behind the scenes who conduct research, outreach with our guests, and do all the things that I don't know that you do. This podcast wouldn't exist without you.
This has been the Prioritizing Prevention podcast. For more episodes, you can find us on Spotify, YouTube, Google Play, Apple Music, and many more. This program is funded by Ohio Mental Health and Addiction Services. And for more information about us, please visit preventioncoe.ohio.gov. Thank you for listening.